and especially our cherished subscribers. I can really appreciate the frustration of the people that you interview. I mean, it's frustrating, most especially when you have registered for the health insurance, hoping that you can have access to healthcare. In fact, quality healthcare. And let me put this thing in context. When you register for the health insurance, we have the benefit package that take care of inpatient and outpatient. And inpatient essentially means that when you go and you are admitted, which is comprehensive, that means you don't have to pay for bed. And unfortunately, when your reporter went there, people had been charged for beds.
20 cedis, 100 cedis in some instances.
I don't know whether they were issued receipt for that, which is illegal. And health insurance is not just, the organization is not just there and, letting this thing go on unpunished. Recently, we have an occasion of deducting huge sums of money from people's claims because of some of these unscrupulous activities of some of our health providers. I must be quick to emphasize that it's not all the health providers that are engaging in this. And we can only take action when it is brought to our attention like this. So when I heard this report, I mean, it was just nauseating, to speak to say the least. So we have taken steps to address some of these things. And then secondly, when you say the health insurance doesn't cover every drug, I quite remember I had some informal discussion with you when I was asking you, tell me which of the drugs have been expunged from the health insurance benefit package. I'm not able to speak specifically to this because I don't know the kind of drug that.
Okay, so forgive my rude interruption. I go to the hospital, or let me use the case of the voices we heard. Somebody goes to the hospital,
okay,
and a patient is on admission, and the prescription given to him to go and buy medications, none of the medicines was provided by the facility. All the medicines he had to go out and buy. And if you heard him correctly, he said, we cry anopadia in medium buy. So if there's a need for him to buy some more medications for the patient in the evening, it's going to be problematic. So how is it possible that the patient on admission will have to buy every single drug to be administered, that none of the medications needed falls under the health insurance such that he has to go buy every medication? Is that what you're saying?
It's an outline, David. I have never even, it is strange to you and to me. Because we have pharmacies that have been accredited for the health insurance. So what kind of drugs are they providing for our patients? This is strange.
But you had another person also complain that even the ones that are given, that was a different patient or a different person, even the ones that are given are cheap medications.
According to the patient?
Yes.
Who is not even a pharmacist or
but you and I know that when it comes to paracetamol, there are different grades of paracetamol. There are paracetamol that are very efficacious, very effective, that can cost you as much as, let's say, 10 cedis or more. There are others that can cost you 50 pesos.
Well, I must be quick to also emphasize that health insurance do not pay for branded medicine. It pays for generics. Okay? It pays for you know what? Somebody was telling me something. That the shirt that he was wearing is the same as, which is a Nike shirt. It's the same as another shirt that has not been branded. So they just the logo Nike makes the shirt expensive, not the quality of it. And unfortunately, you see, when we say health insurance is free for people, there's the psychological disposition of everybody who has access to something that is free. It is termed as cheap. But trust me, until you go for a health facility that you don't have money and you are being treated and the doctor tells you how much you are going to pay if you had no health insurance, that is where you appreciate the importance of the health insurance. And it speaks volumes of this because, look, David, you and me know that the health insurance card is just for access to healthcare. You don't use health insurance card to buy food. Neither do you use it for transportation. So if it was that bad, in your own wildest imagination, how would about a whooping more than 17-point-something million Ghanaians have subscribed to this?
And of course, you heard the Vice President say, for example, since 2017, the number has increased by some 61%. But bottom line is, the fact that people are registering is a different matter from whether they are having the kind of quality treatment that they are seeking. Having a card is one thing. Having access to for the usage of the card is another.
Yes. David, that is why we are here. Because, listen, before health insurance, when there was cash and carry, who were the spokesperson for the patients? You are going to hear some of this voice loudest as we go forward. Because people are beginning to know their right. You understand? And then the contribution were paid to the health insurance authority for us to take care of our people. As we increase in numbers, these are some of the teething problems that we are going to encounter. The onus is on us as health insurance to be able to deal with it decisively. That is why I just want you to avail your mind to what I initially said, that some providers, which evidence was brought to us. In fact, we had punished them. We have deducted some amount of money from their claims. Once last year, we set up a mystery shopping with some of our staff going to a facility. I don't want to mention him. It will interest you to note that the facility is even a Christian health facility, and then they were charging monies for simple malaria and all of that.
Unapproved monies.
Unapproved monies. Yes. And
what will make them charge these monies?
That is
what would make a facility, whether Christian or not, say that, well, on the drug list, this drug is going for, let's say, 10 cedis. But I'm going to ask that you pay an extra 5 cedis for the drug. What's going to make a facility do this?
David, you are just pushing me to risk a guess.
It's not about a guess. These are subscribers. Listen, you are the regional boss for the National Health Insurance Scheme. Your subscribers are complaining about the kind of treatment that they get when they get to the facilities. Your subscribers are telling you that they cannot get free beds. They have to pay for the beds. Your subscribers are telling you that, listen, even when we go to the facility, we have to go buy medications outside that health facility. Doesn't that bother you? You are the regional boss for the health insurance. These are your subscribers.
David, let me also remind you. You asked me, what would a provider charge? That's why
what will make a provider
charge
extra?
That's why I was saying that it would be very hard for me to risk a guess, to read into the minds of the provider why he's charging that, because we have a contract with you, okay, to provide a certain set of services and provide drugs for our patients when they come to seek medical care. So if you decide to charge them illegally, then of course then you have your own ulterior motives in doing that. And then secondly, see, it is not as though when we hear some of these complaints, we do not try to address it. That is the more reason why, David, I'm here. That's the one reason when you call me, I said I was going to address some of them. If it is brought to us, we deal with it. It will surprise you that one time I was listening to the chief executive of Konfanoche. Some people went there and they were charged illegally. Apparently, those doctors who charged those patients were his own friends. They were suspended and their salary withheld.
Yes, I was in a meeting. I was in a meeting where Professor Adams mentioned that some doctors had misconducted themselves and sanctions applied. But